to keep the part that's going into the skin as clean as possible. So we add the tip. There we go. And then the next thing we do, I'm going to show you, I'm going to test it. So part of the way we test it is by using some alcohol on gauze and we select, so 24, 5 energy, let's do 5 for a second, stand by, and then we'll put it over it. Great, so we're good, and it works. So like the last time, we're going to start off on the forehead, okay? We'll start on the forehead really light. Part of the reason for that is obviously, number one, you don't have a lot of wrinkles or anything like that. You have a little bit right here, so that can help kind of resurfacing it, but we don't want to go too deep and too strong on the forehead, right? So we'll stick to 4, and then we'll go to, let's go to 2, and then we'll see how that works on you, okay? A treatment, this is a patient's second Morpheus8 treatment. Obviously, main complaints with this patient, she is a young, mid-30s patient who is looking to treat some skin laxity, but in general wanting to just do some preventative skin care, wanting to produce some collagen and elastin underneath her skin, and so that's one of the things that Morpheus8 does. So we're going to go ahead and start by going into the forehead. All right, ready? Yes. And then you keep me posted in terms of your comfort levels, okay? All right. Good?
Yes.
Great.
It's 5.
5.
5, 4.
Okay. So we're done on this top side of the forehead. Turn your head that way. And then let me know if you're too uncomfortable and you want me to change the settings. Yeah, obviously, one of the major complaints of having Morpheus is the potential for having some uncomfortable pain. So we make sure to try to keep the patient as comfortable as possible by applying 23/7 lidocaine tetracaine blend. So the other part is obviously making sure that you are having that conversation with the patient, because different patients will have different tolerances, right? And so different patients have different experiences with it. It also really depends on like the level of depth and like energy that you're using. So on her, we're using low energy right now. We're using low depth. So we'll take a look and see how she progresses in just a little bit. Ok, vamos a seguirle. Tu cachete, okay, de los dos lados, okay? Sale. ¿Preguntas?
No.
Readies?
Yeah, I'm ready.
Okay, I'm going to go up a little bit in terms of energy, not too much, okay? Depth is staying the same. See? Okay, turn your head to the side. Great. Another thing that's really important is a patient, for example, like her who's super young, still has like nice healthy fat pads. You don't want to go too deep. You don't want to go too strong on the energy, because you don't want to, melt any of these healthy fat pads that are in her cheek area. That was actually what makes this look youthful. You also don't want to go too high on the energy, simply because of her Fitzpatrick. So she's probably like a 4 and 4, maybe going into a 5 in terms of Fitzpatrick. So people with higher Fitzpatricks should not have high levels of energy, because the high levels of energy can cause burns under the skin that it wouldn't normally cause on a lower Fitzpatrick patient. So that's why we stay much lower on the energy level. And so in her case, we would probably, our maximum we would ever hit would be maybe a 20 on the energy level. So right now we're at 10. All right, ready?
Yes.
So. I mean, the real reason for its popularity is simply that it's effective, right? And so it's effective for lots of different things, as we mentioned before, but in general, it's a creation of the, as it is, it's an RF microneedling, so therefore it creates, helps to create collagen and elastin over time. It helps to essentially melt some of those fat pockets that we want to melt. So when you're intentional about it, you can do that. And then in addition to that, it's also about like the elasticity and the laxity of the skin. And so this has actually been proven to essentially help with the laxity of the skin. So one of the things where it's really growing in popularity nowadays, and it's not only in the face, but the abdomen and other areas, is the fact that there's some individuals who, a lot of people are doing GLP-1s. So the weight loss, the rapid weight loss, and there's a lot of laxity in the skin. This helps with that. So, all right, cool. So we're gonna do a second pass on this side, and then we'll kind of continue going in the neck, okay? Bye. So some of the things that we're looking for right now when we're actually doing the treatment is kind of seeing how she's reacting. Some of the things that we want to make sure is that she's comfortable, which so far she is. But the other thing is you're looking at the skin, making sure that, you're looking for those particular, signs that the procedure is going well. So there's like this, natural redness and inflammation that's happening, which is perfectly normal. And that's exactly what you're looking for, right? You're looking for the fact that there is some skin reaction to it. You wouldn't want anything that's extreme pain. You wouldn't want anything that's extreme redness. You wouldn't want anything, as you can tell, there's really little to no bleeding. It's mostly pinpoint bleeding. You wouldn't want any, major bleeding or anything like that either. So, yeah. Okay. So, Adri, vamos a empezar de este lado, pero para hacer eso, what I want to do is kind of sit you up a little bit. Okay? Okay? So.
¿Y qué tal aquí, Orma?
You really don't need a whole lot there, but actually, what I will do is a little bit in your nose area, and we can do just very light here.
Okay.
Okay? Yeah, before we actually move on. Except on that, I'm going to go down to a 1 and up the energy level to a 5. Great. So let's do that. Oh. So the reason that we're going to sit her up here in just a little bit is because we are actually really trying to get gravity to help us in targeting some of the areas that we're really targeting, right? So as mentioned before, laxity is a big thing for us. We want to be able to help, with, some of that skin laxity. And so the way that we do that is by helping, having gravity help us to kind of find those areas that are hanging a little bit more than we want. And so we target those areas. Just a quick nose stamp, okay?
Mm-hmm.
Good. That's the other side. Quick nose stamp, 1, 2, and 3, and then purse lips. There you go. Does it feel okay? Mm-hmm. Great. Okay. Right, so I'm going to sit you up just a tad bit. Try doing a 3 and see if you can tolerate the 3, okay?
Okay.
And then if it's too much for you, let me know.
Okay.
Ready?
Yes.
We'll go into a 10 on this energy level. We'll go into 3 depth. And then let's see what we can. How does that feel? You smell it a little bit, huh? How does that feel?
Wow, that was a dimmer channel.
Good. Okay. Good. I'm gonna hit this post jowl. Well, in the neck area, obviously, we're wanting to go a little bit less depth, so we're sticking to a 2 millimeter at this point in time. It's a more delicate area. We've got some fine lines in this area here that hopefully this will help to treat as well. And then we're going a little bit harder, if you'll kind of move your head down just a little bit, you see some of this, jowl area and underneath the submental fat area where there's a little bit of laxity, so we're hitting that a little bit harder with a deeper, probably like a 3, 4. So yep. Okay, we can go back. Great. So one more round in this area of the neck. Okay, and then we'll go back to this area where we're gonna.
Okay.
And then we should be done with that. Still pretty good. Okay. So some of the instructions that we want to give our patients after they've had a Morpheus treatment is obviously, the first night or first day afterwards, wash your face with a little bit of water, but you don't want to use anything that's going to be harsh on the skin. As a reminder, it's a microneedling, therefore there's still like micro pores that are essentially, or micro channels that have been created by doing this procedure, and so anything you put on it is going to be even more absorbed faster, right? So just a little bit of water. If you do want to put sunscreen on, you want to protect yourself from the sun, even if it's cloudy outside. Remember, like, sunscreen is still important. The following day, you can do a little bit of a mild soap. And then, 48, 72 hours afterwards, you can start to kind of little by little start, implementing your normal skincare routine, but you do want to wait a little bit as your skin is healing. You may see a little bit of scabbing. You may see some of the grid marks on your skin. That's normal. That's part of the essentially healing process, and you'll notice that those will go away within about a week. Okay. You never want to see anything that's going to be extreme pain, extreme redness, anything that would indicate that there's any kind of drainage coming out. Those are always signs of potential infection, in which case you would want to notify us right away, right? But again, that's part of the reason why we make sure that we're cleaning the face appropriately, that we're actually using that sterile. You always want to use a sterile needle. Don't take it out before you have to. So just leave it in the pouch until you're ready to perform the procedure to keep as clean as possible. So yep.
No, thank you.
Yeah, you're welcome. Any questions?
No, thank you so much.
All right, thank you. So tell us a little bit about your experience. Do you feel like it was painful?
You know what? There were some areas where you can feel the needle, but it wasn't that painful.
Right. So you probably feel like the needle going in, but it's not actually causing any pain. You just feel the sensation of the needle going in. And obviously this is your second treatment, right? On your first treatment, did you feel like your healing time was
It was
long?
super quick. No, it was the healing part. It was quick.
Yeah, and you felt pretty comfortable afterwards. you know, even with the lidocaine, I mean, I always tell people, you know, after you get out of here, avoid eating anything like that's super hot or anything like that, because you might not be able to tell that it's too hot. But did you feel like the lidocaine wore off fairly quickly after you finished your last treatment? Yeah, awesome. All right, would you have any recommendations for anybody?
You know what? I'm gonna tell my sister to come and
Awesome.
do the same process.
That's a good idea.
Oh,
yeah.
yeah.
Come on over. All
Thank
right,
you.
fantastic. As mentioned, my name is Eduardo Orozco. I'm certified nurse practitioner here at Hydra Hive. You could reach myself or any of our, InMode Optimus Max certified professionals by either calling us at 210-255-1593 or going onto our website, which is hydrahivesa.com. That's hydrahivesa.com. Don't forget to like and subscribe. If you have any questions, comments, please go ahead and add them in the comments below. And of course, don't forget to follow us on Instagram at hydrahive_SA.